We announced our new product, Unity Confirm, which will be clinically available to patients starting May 28th. And this is the first ever non-invasive confirmatory test used for patients who have a high-risk cell-free DNA test for aneuploidy. And so what this test does is it captures, we have a fetal cell capture technology that captures rare trophoblasts that are circulating in the maternal bloodstream. Those trophoblasts are then identified and confirmed to be fetal in origin through our process in the laboratory. And then we do whole genome sequencing to determine if that particular cell has the extra chromosome that was indicated on their abnormal cell-free DNA test. So that's a great question. So the 16 out of 16 confirmatory results is really, really important for us to be able to provide as we launched this test. A few things that are important to keep in mind. The first of which is this technology and this approach has been studied for many, many years. Right? So there are multiple publications across the world that have looked at fetal cell capture technologies, and it has been very clearly determined that if you can isolate a circulating fetal cell and then do genomic sequencing on it, that the results are very accurate, right? So that's the first thing. So we wanted to build upon that literature with our study. And so the initial study just showed that with our process in the laboratory, that the results of Unity Confirm were concordant 100% of the time with the results of the CVS or the amniocentesis that was provided on that particular patient. We're going to expand that to include and enroll over 1,000 patients to continue to provide updated performance data and continue to characterize this particular approach now that it is clinically available to patients in the United States.
Well, clinical guidances have always considered the gold standard to be an invasive test. And that would be either for a CVS or an amniocentesis with a person who has an abnormal cell-free DNA for any of the aneuploid events. That's been the standard for decades. What we're showing is that by Unity Confirm, that you can, within a certain number of weeks, a certain number of days, by capturing that fetal cell and doing the genomic sequencing on it, you can confirm whether that cell-free DNA that showed an aneuploid event is indeed concordant with what you found. So in many ways, it takes into the equation that this is non-invasive. It's an extension of a non-invasive approach for confirmation. Now, clearly, there are individuals who might want to continue to get more invasive tests. That would be not unreasonable at all. But in many instances where people have access issues to getting to an established subspecialist who could do that invasive test, they would have the answer to the fact that their cell-free DNA that showed an aneuploid trisomy 18, trisomy 13, trisomy 21 would be confirmed by that fetal cell that we've now captured in the maternal blood. Now keep in mind that ever since we got cell-free DNA in 2011, the number of invasive procedures compared to what I used to do in the early 2000s for amnios and CVSs have significantly gone down. I think that we won't see that much of a demonstrable change in that, but we may. But the idea is that when you do shared decision making and you have this much information available to you in a non-invasive fashion, there might be a fewer people who are going to want to have an invasive test with more risk. Every amniocentesis and every CVS carries a certain amount of risk. And I think that's where we might see that person. But clearly, because of access issues and so forth and so on, we're going to still see a number of people who are going to be referred late and may very well need to have a more invasive approach to this. So we're thinking that it will not impact the actual invasive procedures, but every invasive procedure has some risk.